Hello viewers, and welcome again in another very important video about our body. And today we'll learn about the kidneys. We'll see that what kidneys are, where they are located, and what are some of the causative factors or risk factors which can put your kidneys at risk and can lead to severe conditions like renal failure. Also, we'll see that what are some of the early signs and symptoms which can help identify and prevent yourself from further damage. At the end, I'm going to share some top holistic remedies which can also help improve these conditions. So thank you very much for joining, and I welcome you in my channel, which is Mind and Body Alternative Health Clinic, and I'm based in Birmingham, UK. So kidneys are very important organs in the body, and they've got multiple functions. Basically, there are two kidneys, and they are located one on each side at the back, at the lower back. And when there is any issues with our kidneys, we find various kind of signs and symptoms, and that is something I'm going to share in next slide with you now. So first of all, we will see that what are some of the common causes of kidney damage. But please make sure to read this disclaimer. It is not intended to diagnose, cure, or offer any treatment, but to give you some basic awareness and knowledge about our health. So please make sure to read this disclaimer and avoid self-medication. So kidneys are very important organs in the body. As I've said, they are two in number, and one of their main function is to filter waste out of your blood, which can also help control your blood pressure. So one of the main key functions of our kidneys is to filter and remove any toxics or any waste from our body. And if it fails to do so, we can retain those toxic material, and it can build up in our body and cause a lot of complications. So when you remove any toxic material from the body, you can excrete any excessive buildup of that. You can also help manage your high blood pressure as well. So kidneys can remove excess waste from the body and also help maintain your high blood pressure. So these are some of the main key functions of your kidneys. Now, what are some of the possible causes or risk factors which can damage your kidneys? Blockage. So blockage in the urine flow that may cause infections. This blockage could also be due to calculi or stones, urethral stricture, or also an enlarged prostate. So if you've got any kind of blockage in your urinary system, this can cause backflow or more pressure towards your kidneys, because there's a way one way movement of excretion of waste from the body. And when there is any kind of blockage due to infection, due to stricture, due to enlarged prostate, especially in men, it can cause backward flow towards your kidney, which can put pressure and unnecessary straining on your kidneys, and that can lead to kidneys damage. Also, if you have problem with your liver, or you've got problem with your heart, especially when they are in liver failure or heart failure conditions, any kind of nerve damage to your bladder, inflamed kidneys because of some sort of infection, because of an autoimmune conditions like lupus or multiple myelomas. Your kidneys can also be at risk due to reduced circulatory blood volume to your kidneys, serious burns or dehydration, severe decrease in your proteins levels in the blood, and also because of acute gastroenteritis. So there are many factors which can cause kidneys damage. Also, people with high blood pressure, they are always at high risk of damage to their kidneys. In shock due to septicemia or anaphylaxis, or a condition which is called thrombosis or DVT, deep vein thrombosis, which can cause embolism in your renal arteries, can also cause renal damage. Even blood poisoning during pregnancy in females can also cause renal damage as well. So there are many causative factors for renal damage. It could be due to blood clots, DVTs, thrombosis in your blood as well. It can also be due to during pregnancy, and many women during pregnancy, they are also at high risk. If you have recent blood transfusion and that was mismatched, that can also put risk at your kidneys. And people with high cholesterol deposits. Certain medication, especially medication which we normally take for pain relief, like NSAIDs, ibuprofen, naproxen, chemotherapy medicines, contraceptives, antibiotics, and also certain blood pressure medicines can cause kidney damage as well. But it is not linked only with allopathic medicines. Even if you do self medication, even with herbal supplements or home remedies, they can also put you at risk. So please be careful. Even if you are using herbal medicine, even including ginger ginger in your kidneys, they can also cause a lot of kidneys problems, because there are so many researches and recent studies that people who die because of kidney damage, when they found out, they were taking many herbal medications, including ginger intake on their daily basis as well. So please avoid self medication even with herbal supplements, because even herbs are not always safe, because anything that you intake could put pressure on your liver, on your digestive system, on metabolism, and ultimately on your kidneys as well. So there are many factors for that. Now, what are some of the early signs and symptoms if you are prone to any kidney issues? So mainly people they have scanty urination, which means they have less urine output than normal. Swelling or edema in their legs, ankles and feet. They feel drowsy, lethargic or very tired. Severe itching, joints pains and muscles twitching, confusion or mental impairment. Sometimes they also may experience chest pains or pressure. In severe cases it can also cause seizures or coma, stomachache and backache, fever, high or very low blood pressure. You may also experience lack of appetite, nausea and vomiting, gastrointestinal bleeding or nose bleeding, and also a lot of patients, because of a lot of blood loss, they go into iron deficiency anemia as well. So there are many early signs and symptoms which can help you identify this condition, and then you must go for further diagnosis, see your doctor, your GP, and let them diagnose. And if you suffer from any kidneys issues, try to prevent it from very early damages, and also you can try various preventions and home remedies as well. Some patient may also experience build-up of water or fluid in lungs, which may also cause shortness of breath or dyspnea. Body's vital fluids and electrolytes loss can cause muscle weakness as well. So these are early signs and symptoms of kidneys damage. Now at the end, I'm going to give you some helpful tips which can prevent further damage to your kidneys, and you can prevent further deterioration as well. So first tip for you is to eat healthy, stop smoking and drinking alcohol, stay hydrated, manage your high blood pressure, high cholesterol and sugar levels, and also reduce your salt intake. Avoid unnecessarily painkillers, or especially analgesics which contain NSAIDs, non-steroidal anti-inflammatory drugs. Maintain your good healthy weight. Regular exercise can help you maintain good healthy weight, and also reduce and manage your unnecessary stress as well. Now these are some top 3 herbal supplements for kidneys health. So consider unsweetened cranberries, either cranberry juice, or you can also consider cranberry as supplement, because cranberries contain a lot of good antioxidants, antibacterial with anti-inflammatory properties. Also include more cardamom, which acts as a diuretic, as a natural water pill. And you can also flush out any toxins and retain water from the body by the use of cardamom. Flax seeds is another great choice, because this can also protect kidneys from further progression to renal failure, and also slow the process of further renal damage as well. So if you have any risk of kidney failure, you should consider things like cranberries. Either you can drink its juice, but it should be unsweetened if you especially suffer from diabetes, or you may consider its supplement. You should also consider cardamom and also flax seeds supplements as well. And finally, I'm going to share top 3 homeopathic remedies, because in homeopathy, as a homeopath, we have to see the causative factor. We also see the concomitants, that any other associated condition apart from this main complaint, and then according to you presenting sign and symptoms, we select the remedies, and if you take those remedies for few months, you will see desired results as well. So here are top 3 homeopathic remedies which can be very helpful for kidney damage, even if you're suffering from initial stages of kidney failure as well. So the first remedy is called arsenic album. So start with 30C and take 3 times a day. You can also add another medicine which is called Apis mellifica, and that will be really helpful if you've got edema or swelling in your body. Again, start with 30C potency up to 3 times a day. And there is one more biochemic supplement in homeopathy which is called natrum sulf, so take it in 6x potency. So never take homeopathic remedies in dilutions or as in drops. Always ask your local pharmacist to give you as in pills. You can label them and take about 4 to 5 pills according to their size up to 3 times a day. And if you consider these top 3 remedies, as I've said, the arsenic album and also Apis mellifica and natrum sulf, you will see amazing results. If you need any further help or advice, you must seek professional advice from a qualified homeopath. If you want a direct consultation from myself, you can always contact me through the number provided on the screen. So we can discuss in more detail, and I can give you probably much more specific remedies which can help protect your kidneys. And if you're suffering from even initial stages of kidney damage, you can probably help reverse those conditions as well. So thank you very much for watching, and as I've said, avoid self-medication. Speak to a doctor or GP before you make any changes in your treatment plan. I'll see you again with another topic. Until then, take care and bye bye.